Actually spinning,
Oh, I see.
and this is my capper.
So you run them both in one rig? You typically need an undergraduate degree and then a professional degree, either an MD, which takes 4 years, or a PhD, which typically takes about 5 years. Then if you go the MD physician route, you need a residency of 3 to 7 years, and then at least one fellowship and maybe an additional postdoctoral fellowship. So you're really getting near 40 years of age before you get your first job. So it's about 20 years of training after college can be before you're qualified. Now, along the way, while you're training, you're doing a lot of the work. So it doesn't feel like you're not working yet. You're actually doing work as part of training. But really, in terms of having a stable job where you have a title that doesn't end after 1 to 2 years, it's about 20 years to get there. So it's a long road, but it's fun along the way, or can be fun. Typically, if you want to run a lab, you're going to have a doctoral degree and a number of years of postdoctoral work. We also have staff members that work in my lab, many of whom just have a BA or a BS and then work as technicians. And that can be very fulfilling because right out of college you can go into a lab and work, and we train you on the job. Then there is sort of an intermediate level, which the woman who is my lab manager and runs my lab is a very capable person who's a professional scientist. She got a master's, and that gave her more experience and how to do science. So she actually manages our lab. So we have a number of master's level people too. So you can do it with a college degree. You're better off with a master's degree. If you want to run a group, you're really going to have a doctoral degree plus postdoctoral work. I think one of the central personal qualities that's very helpful is to be able to multitask. So in one day, I might be in the clinic in the morning seeing a very complicated infectious disease case, and then I'm actually training physicians in training, so I'm actually flipping into a teaching mode. So I'm dealing with a patient, and then 5 minutes later I'm teaching, and meanwhile my email device is going off, and I'm corresponding with administrative people about money and with my scientist people about data, and I'm flipping in and out of those jobs. So I think multitasking, being able to flip in and out of different worlds is very helpful. I think patience, too. Some of the research we do, we'll do experiments for 3 or 4 months and nothing will work. There's nothing to show for it. And yet we know the project's good and it's important and we have to see it through. So if you're somebody who needs a resolution or a gratification within a day or something, that isn't a good career for you. You really have to be patient. And I've been working on, for instance, a vaccine for pneumonia for children since I started in science, and I started in 1990, so now it's 2008. So I've been working on this vaccine for 18 years, and it's not even close. So I have a dream that one day I will see this come to fruition, but it may be a 30-year process or more, or I may never see it, and I just have to live with that.